Hi, everyone. Thanks so much for joining our panel today. So my name is Mala, and I run the Tech for Social Good program here at GitHub. And before I do anything else, I want to give a big shout out to my fellow social impact colleagues, Toya, Admas, Cynthia, Camly, Andrea. Thank you all so much for everything that you do. Now, today, I'm joined by two brilliant colleagues from the World Health Organization. Dušan is the lead architect in public health intelligence, and Sara is an epidemiologist with the Health Emergencies program. Welcome to both of you, and thank you so much for being here today. I also want to give a shout out to my colleague Bassem, who is a solution architect on our professional services team. Now, Bassem and I have been working side by side with WHO for the past couple of months, and he was meant to join us today as a panelist. Unfortunately, due to circumstances beyond his control, he's unable to be here today, and so we wish him and his family well, and we look forward to his return in January. If you're not familiar with Tech for Social Good, we're a program at GitHub that essentially ensures that our people, our products, and our platform are helping the social sector build the best possible tech solutions for some of the world's most pressing challenges. You can learn more about us at socialimpact.github.com. So to kick off the panel today, I want to talk a bit about an interconnected world in public health. If you're able to join us back in May for GitHub Satellite, you might have caught the panel that I was able to host with some incredible social sector partners on COVID-19 pandemic responses. Now, during that presentation, I talked about how we had connected with so many of our social sector partners to really understand how the pandemic was affecting them and their communities in the early days of the virus. And from those conversations, we kind of split it out into three major categories: societal, economic, and pandemic. And while that's still really relevant to a lot of the work that the social sector is currently doing, it is important to note that today's panel focuses on public health, and these categories are all closely interrelated. So if you're not familiar with public health as a discipline, essentially it's looking at the health and well-being of people in societal and community-based levels. And a seminal person and a seminal event in public health was John Snow. Now, speaking of England, John Snow was an English physician in the 1850s, and in 1854, there was unfortunately a cholera epidemic that broke out and killed about 800 people. At the time, it was thought that cholera was transmitted through little particles in the air, but John Snow had his suspicions otherwise. And so what he did was he went and tracked each of the individual 800 people who died, whether it was in a hospital or whether it was in a school or a household or a business, and in some cases even a prison. And he plotted all of that on a map. And from the work that he did, he was pretty clearly able to demonstrate that cholera wasn't being transmitted through the air, but the contamination source was actually a well located on Broad Street in the Soho neighborhood of London. And he was able to convince the local government that because of this, they should take away the pump to the contaminated well so that nobody could access that water source. And almost immediately, the cholera cases went down. Now, this is important not just because he dispelled a really popular myth about cholera transmission at the time, but he also laid some really foundational work for a field called epidemiology, which, as Sarah's going to tell us more about later, is a field that looks at the tracing of diseases like infectious diseases, non-infectious diseases, and other health events like cancer in a population. Now, John Snow's work is seminal to public health, and in fact, it's still cited and used today. Now, to state the obvious, the world has changed a lot since the 1850s. And in fact, if we look at data from the United Nations Department of Economic and Social Affairs, UNDESA for short, which started reporting data in the 1950s, we can see, for example, some indicators that show us how much the world has really changed. Now, one figure is population itself. So in 1950, when UNDESA started reporting data, we were at about 2.5 billion people worldwide. Fast forward to today, 70 years later, and that population has tripled globally. We're at about 7.8 million people. Migration is another really interesting number. Back in 1990, there was about 153 million people we could consider asylum seekers or refugees or immigrants who went abroad for work or for school or for family. Now today, just 30 years later, that number has grown to 271 million. So that shows us the scale of which we're growing as an interconnected world. Now, perhaps the most stark comparison is coronaviruses themselves, right? We've all heard this word a lot over the last year or so, and coronaviruses essentially refers to a set of viruses that can cause anything from a common cold all the way up to really severe respiratory diseases like COVID-19. So if we look at some of the coronaviruses in recent memory and the diseases they cause, we get a stark picture. For example, in 2012, there was a coronavirus that originated from the Middle East and caused a disease we now refer to as MERS. Over about an 8-year period where there was the most active cases, there were about 2,500 cases reported. And if you're my age or older, you definitely heard about a disease called SARS, which came from a coronavirus in Asia in 2003. That caused about 8,400 cases in an 8-month period. And for sure, there's a lot of nuances with the numbers you see here on the screen in terms of the way that cases are counted, so the methodologies that are used, the period over which you count them, and then, of course, the actual virus's transmission and the diseases themselves. But even if we take all of those nuances into an account and we multiply the number of MERS and SARS cases by 10 or by 100 or by even 1,000, we are still not approaching the scale we see with COVID-19. As of when this deck was finalized, we're at 63 plus million cases. And because we're in an active period of COVID-19, that number is definitely going to rise in the coming weeks and coming months. So all of this is to say that COVID-19 really reinforced the idea that the world is just too big, it's too complicated, and it's too interconnected for any one country or organization to address public health on its own. Now we're seeing really amazing collaboration in traditional public health, especially with COVID-19 vaccine development. And through our research and previous presentations here at GitHub Universe and Satellite, we've had the privilege of highlighting some incredible organizations that are really at the cutting edge of technology public health collaboration. But even though that's been around for more than a decade, we know that there's more that we can do to strengthen those solutions, to further democratize those solutions, and really to move to more evidence-based approaches. Now, we know open source is a really critical part of that journey, and to that aim, GitHub is really proud to be an implementation tool for public health technology open source collaboration. Well, before I pass it on to Dušan, I do want to point out that the World Health Organization lives on GitHub at github.com/World Health Organization. So take note of this link because we will be referencing repositories here throughout the presentation. Over to you, Dušan, to talk about public health intelligence.
I need to say again, thank you, Mala, for a great introduction. Actually, making it easier now to jump into straight what we're doing. Again, good morning, afternoon, evening, everyone. Early detection of events and their timely verification assessment of risks to provide actionable information for rapid and effective response to public health threats is a key to mitigate and to even neutralize, if possible, impact to societies, economies, and most importantly, to save lives. And it's become obvious to everyone, I guess, because of the situation we're in with COVID-19. This is the scope of public health intelligence discipline that I'm engaged with my team in WHO. So what kind of events are we looking for? Early detection, verification, risk assessment, as I said, is one of the strategic priorities of World Health Organization. Current global situation we found ourselves in with COVID-19 has made it all the more visible and urgent. And in response to ever-changing landscapes, including the way people communicate, relate, interact, public health intelligence discipline adopted all hazards, one health approach. So what does that mean? For example, massive urbanization caused that people connect with animals and nature much more than ever before. Maybe you didn't know, but 70% of known infectious diseases are considered as zoonotic, meaning that pathogens move from animals to people. Therefore, we do not just detect and monitor for events that relate directly to human health. We also do monitor and detect events related to animal and environmental health. On the other hand, we monitor not only disease occurrences in humans, but also hazards that have potential to cause health problems, such as natural disasters, man-made disasters, conflicts, mass gatherings. Next, let me tell you then about more what we're doing. Our starting point is data, obviously, and coming from all kinds of sources, and there is no shortage of that, as we all know. In public health, we talk about different kinds of public health surveillance. Information can come from different sources, such as healthcare facilities, clinicians, laboratories, pharmacies, news, communities, field workers, hotlines. Some sources are publicly available, some are not so. Epidemic Intelligence from Open Sources is WHO-led global initiative. The community of practice monitors publicly available information, mainly from news channels, but other public sources. And this call is called Public Health Intelligence from Open Sources. So I guess you may ask, but why do you monitor, why do you try to detect what is happening and events of impact to health from all this enormous amount, mostly relevant information from all these publicly available sources like news, social networks, etc. Why don't we use information directly from the source, from the healthcare, about the patients when they are diagnosed for precise given conditions? Data is actually not readily available from the source. And when data is made available through official channels, it's delayed to an extent that the delay itself can be a public health threat. So that's for early detection, verification, risk assessment. That's why we are looking at different type of sources, publicly available sources of news, trying to detect events as early as possible. Before I tell you how does it look like really, let me tell you something about the history. So next, everything started when the web goes public. Soon after, in 1994, ProMed started providing emails to their subscribers with latest news related to public health. Going forward to 2009, Global Health Security Initiative was a major milestone to organizing towards connecting content of these different public health intelligence systems that were developed prior to that. In 2013, Joint Research Center, European Commission, the same team who developed Europe Media Monitor that you can see on the screen in 2002, helped WHO to set up hazards detection and risk assessment system. And that system evolved in 2017 into the system we have today. Its name is Epidemic Intelligence from Open Sources. And that system uses not only information from publicly available sources on the World Wide Web and social media, but also information from these other public health intelligence systems. So basically, in a way, it brings together all information we have access to for the purpose of early detection, verification, risk assessment, in order to inform and provide action intelligence for timely response. So next, this is how EIOS system looks like from the user's perspective. On the left-hand side is a navigation panel. And there you can see a global surge of news corresponding in time with COVID-19 detection and confirmation in China at the end of 2019, beginning of 2020. Article panel on the right-hand side contains a list of news that are automatically categorized as in near real time within a natural language processing pipeline of the EIOS system, as containing content about hazards that have potential for public health threat. Since COVID-19 outbreak, approximately 100,000 of those kind of news are processed and stored in the EIOS system each day. Before we had influx of 15,000 news of that kind each day. So you can see the surge and the amount of information we are dealing with since COVID-19 outbreak. EIOS searches for content within 30,000 news feeds and from 12,000 web sources, 80 languages, 240 Twitter accounts, and currently we have more than 40 million news items. Next, this is a sneak peek of how user sees EIOS system. So navigation panel on the left side actually provides text mining features for narrowing the search for events that have been reported in news. An article panel on the right side is made up of news filtered according to these criteria selected on the left side. And in this example, a user is selecting respiratory symptoms, looking for pneumonia and unknown disease. And you can see that on a weekly basis from mid-December 2019 to mid-January 2020, the amount of news is increased sixfold. And also you can see on the right side of the map that these news are mostly placed around the region of China. Next. Well, next, let me tell you why we're here and what we'll tell you more at the end, and why open source. But let me start with tell you that WHO's main objective actually is to help countries worldwide, as you know, to connect, collaborate, and share information and knowledge to improve health and well-being. So that's the sole role of WHO. The key World Health Organization objective will be strengthened by developing information infrastructure for connecting information and knowledge in a global network of information. So I told you how we detect today event potential threats as early as possible. And I told you that we don't have possibility to connect directly at source to get patient health-related data from healthcare systems and their individual observations maybe. Obviously, if we would have had this kind of access and capabilities, then we would have even earlier detection of more relevant data. This issue is complex and it's important, definitely complex and multivariate, and definitely we don't have time in this panel to talk about this. But what can we do in the meantime? Well, in the meantime, one way is to continue improving early detection from publicly available sources, and we can mine volume of information using different analytical methods. We can need a stack of information available publicly. However, we have challenges. All this massive volume of information includes conspiracy theories, mis and disinformation. We have combination of opinions and facts. So how do we verify the disinformation so we don't act on myths? Well, alongside of analytics that we're using today, and natural language processing, trying to discover content and context in this publicly available information, we planned to go with linking data, information, and knowledge available in different systems worldwide, such as those which provide public health intelligence and those which provide contextual information. And then we can, if we have this network of information semantically linked together, we can discover patterns in disease progression and spread, discover similarities, unravel anomalies, while complying to local data protection rules and regulations. And this is exactly strategic objective of WHO going forward with public health intelligence. So next, how do we plan to achieve this objective of fostering connection and sharing data, information, and knowledge, not only between countries and people as we're doing today, but between different information systems and data sets too? Well, we're working internally to establish a strategic WHO initiative to develop support of evolution of this information network that I mentioned. And this information network will power and be powered by the connected artificial augmented intelligence systems to support not only early detection risk assessment, but also to discover patterns of diseases and to learn to forecast new outbreaks maybe one day in the future. So by the end of this presentation, I'll tell you more about the type of open source projects that we have and give you more ideas about why these projects are seen as open source. But before that, I will let you, Sara, tell you how the team uses technology to support field workers in contact tracing. So with that, Sara, over to you.
I'm going to briefly walk you all through the Go.Data implementation journey so far, and how, in the context of the COVID-19 pandemic especially, the rapid scale-up of this tool to now over 60+ countries has really hinged on the collaboration of our user base through platforms like GitHub. And as Dušan highlighted, as you'll see on the WHO GitHub page once you visit, this is just one of the many tools engaging the open source community in regards to pandemic preparedness and response. And hopefully it can provide you just a tangible snapshot into how these activities are starting to take place within the organization. So let's travel back in time for a moment to the pre-COVID era, in particular in 2016, when the goal for this project really originated. There was a request from member state countries to WHO to develop a free, lightweight tool for field-level outbreak investigation and contact tracing. This then began the iterative journey of requirements gathering and consolidating experiences from WHO and partner institutions that have participated in outbreak response over the years. The resulting platform, in its more or less mature form, was first piloted in 2019 during the Ebola outbreak in North Kivu. Linked here to an excellent piece that I really like. It's created through Esri's Story Maps platform, and it gives a nice overview of WHO's surveillance activities during this response. Just to hone in and focus on the cornerstone of this and any outbreak response, next slide, testing and contact tracing. So once a confirmed case is identified, the contact tracing process begins and community level teams need to be quickly mobilized. In the case here, ring vaccination of the newly approved vaccine was being introduced, which involves identifying and tracing not only first level contacts, but also secondary and tertiary level contacts. So you can begin to imagine the value in having a really well-functioning, well-structured tool for data collection that enables you to monitor hundreds, if not thousands, of contacts across the various áreas de santé at any given time, and how vital this could be actually in informing practical field level activities on a day-to-day basis. Flash forward to 2020, when suddenly overnight, contact tracing is not just something you hear about in a presentation of the Ebola response, but I think that every country of all resource levels and across all geographies are talking about. And frankly, it was something that many countries needed to implement overnight. Given the digital era we live in as well, contact tracing apps became all the buzz as countries were seeking innovative solutions to quickly face this crisis. I want to spend just a few moments to clarify what I mean by contact tracing app for the purposes of this presentation. The term can be used pretty loosely in the media, and many of you in the audience as developers may very well be working on projects that fall into one of these categories. So WHO guidance on digital tools for contact tracing published back in June lumped these tools into three main categories: outbreak response, proximity tracking, and symptom tracking. The Go.Data tool falls into the first category and serves really as a reference outbreak response tool, either for countries to use out of the box if they don't already have one, or for countries to align their existing outbreak response tool with, thereby ensuring WHO standards on minimum data collection, data privacy, et cetera. So in the interest of time, I'll really fly through a few features worth noting. More information and demos are available online. But here's the initial web app interface. And there are granular user roles and permissions that allow different types of surveillance staff to log in and interact with or access different types of data when they go to perform their necessary surveillance duties. To outline quickly a few user personas, a field epidemiologist may be performing case investigations through the web app and listing contacts, which are then automatically assigned to the relevant contact tracer to perform follow-ups through their mobile. And in the meantime, lab personnel might be entering in lab results in a separate module, thereby prompting and alerting the surveillance team to then know which suspect cases are positive and which they need to perform a full-on case investigation for. A supervisor at the national level can view an aggregate snapshot of the epi scenario, as you see in the screenshot here, or regional teams can dig deeper into their regional KPIs. The platform is built really on structured integrated line lists. So there's an example screenshot here. It's really giving a centralized home to related case and contact data that can often be siloed across various systems, including lab and hospitalization data. Next slide, perhaps one of the most important features is the ability to construct and visualize chains of transmission across the different entities in the platform through space and time. So whether they be cases, contacts, or exposure events. We also have geospatial mapping functionality. So you can see these linkages overlaid onto a base map of your choice. The platform also illustrates the journey of cases and contacts longitudinally. So a few example screenshots here, contact follow-up dashboards, the ability to see visually the sequence of events occurring for a given case, or next screenshot honing in on key time intervals from a performance management perspective. So we're seeing here the time lapse between symptom onset and specimen collection. So really the point here is for the data to be transformed as much as possible into field level decision making and any operational improvements at any time that we can. So now across the past 11 months from our vantage point at WHO, we've been supporting governments and institutions globally to enhance their COVID-19 contact tracing activities through tools like Go.Data and other activities. And this slide shows just a few examples of where I worked with country teams on these activities, starting with DRC last December, Italy in early March, Europe's largest refugee camp in Lesbos in November, and Canton Vaud in Switzerland right here in my backyard. So it's clear how vastly different these environments are, but the teams I've encountered along the way have remarkably similar challenges. Needless to say, there's a lot of power in sharing these learnings across settings and really not reinventing the wheel. In this way, community building around these activities has been an absolute necessity. We all know by now, I think, that the tried and true boots on the ground principles of contact tracing don't change all that much despite which digital tool is used. And we've put a lot of effort in trying to convene a space for different users to interact, whether it be through WHO consultations where countries present their strategies and challenges, through our online community of practice, or through our GitHub repository. Next slide, I think there's a screenshot of our community of practice. And then, yeah, the next slide, we have our GitHub repository there, which feel free to take a screenshot of that. So this is this repo. It's a central place where various users have begun to document and share technical resources developed and used in the context of their Go.Data implementation. So individual users and institutions, we invite them to build on this library of resources and really adapt what they can for their specific setting and then share it back with the community. So a few examples of what this entails. This can include various scripts and code snippets in R and Python to produce automated analyses, dashboards directly from the platform API. We have connectors to Power BI and other external analytics platforms. We also have browser plugins for anonymization of data, middleware layers to kickstart interoperability efforts, since we know it's important that secure data exchange is needed in countries where more than one system might be taking place for routine surveillance and contact tracing. And we really had the pleasure of working with a number of universities and organizations to begin to build out these resources. So at that, we invite you to visit the Go.Data project within the GitHub repo to see how you can take part. I think that's it on my end. I will turn it back to you, Mala. Thanks for your attention.
Great. Thanks so much, Sara and Dušan, for sharing some really interesting insights into your work. Now, as we've mentioned quite a few times in this presentation, open source is a really key part of the future of public health technology solutions. And to that aim, the World Health Organization has been working really hard the past couple of months to open source, not just the work that Sara just mentioned, but also some applications that Dušan's going to talk about in just a few minutes. Now, there's obviously so many organizations, communities, people, individuals, and companies that can plug into WHO work being such a critical portion to the public health ecosystem. But for the next couple of months, these are some of the categories of organizations that are really critical. Now, of course, the journey to effective open source doesn't happen overnight. There's a lot of stages that have to happen in parallel. And so just really quickly, Sara, I would love to hear about your experience here, where WHO is and how it's positively impacted your work.
Sure. I think that obviously I can't speak for the whole organization, but Dušan and I, as he alluded to earlier, and how I can certainly speak from my experience, that we're both part of teams among several other teams at WHO that are very much early adopters of this type of collaboration within the organization. So this inner source kind of movement, that's been really cool to see. There's been an increasing momentum around this so far, and not just across teams and departments and working across in ways that typically they might have been siloed, but even through levels of the organization. So country office, regional office, and headquarters. Not just with the emergencies program and the COVID response, but I used to work on a team at WHO, the WHO Integrated Data Platform, which really screams inner source. It's integrated multidisciplinary team doing a shared data platform, shared reference data and standards across, I think, 7 departments. So with that kind of stuff going on, it's really, really a cause for optimism, and it's really a cool thing to see.
Great, thanks so much. And then, Dušan, I'm going to ask you the question that is on everybody's mind. How can the community get involved? I think you're on mute.
Excellent. I'm struggling with technology. So inner source is one really, really important and key reason why we decided to have a platform such as GitHub for fostering collaboration within WHO. But we have, as I mentioned, during my discussion, that understanding what's there in the world and what kind of information exists, and bringing context together to understand really what is happening and to react based on facts requires really, as Jumala mentioned, collaboration between different players and different people. And we realize that going forward, connecting the world and connecting information data from different sources, we need also to have a grassroots approach. So one thing is evidence-based organizations comes together, bringing things together. But on the other hand, if you want to react early, we also need to engage people. And the more active we all are, the better chance we have. So we have, you can engage with us. We're working actively within WHO to set up governance as we speak for open source collaboration. Before we set up everything, we still open the repository that would serve as open source communication channel. You can see this on the screen, and please take a screenshot or a link. There we can share product roadmaps, collaboration guidelines, and we can use issues of discussion to engage early on with you. We already have a number of open source projects that you will see on that page as well. So there is a scope for collaboration early on, starting 2021. Thank you, Mal. Over to you.
Great, thanks so much. And just to reiterate Dušan's point, please do take a screenshot of this slide so that you have the link. This repository is set up to really be your first interaction in case you want to get involved in WHO's open source work. I want to thank Dušan and Sara for all of their hard work these past few months to get this presentation together and really get all the work behind the presentation. It's been a long haul, and we all should be really proud of everything that we've accomplished. Also, please, to our audience, take a screenshot of the slide. Feel free to get in contact with us. Sorry for the technical difficulties, but we really loved having you here. Thank you all so much.